there you go. Oh, wow.
My feet feel much lighter.
So, tell me exactly what is going on with your foot pain, please.
So, for the past couple of weeks, I'm getting some pain in my heels and the bottom of the foot. So, like when I step on it or go up the stairs, kind of like a pinching pain.
Okay.
And it comes and goes, but it's been bothering me for a while.
And then how long the foot pain has been?
About few weeks now, but I think last couple of weeks has been like really, I can feel the pain.
And then you also mentioned that you have injuries in the past, especially to your left knee.
Yes.
Due to a fall. Would you be able to explain for the viewers, please?
Yeah, so I fell and I didn't break any bones or anything, but since then I've had the pain in my left knee.
Okay.
So I know when it's bad, I'm kind of limping around a little bit.
Okay.
But yeah, that injury was more than 20 years ago.
And then you told me that you've been having foot pain to the left side on and off since the injury. Is that correct?
Yes.
Okay. And then the problem itself is getting worse or getting better?
It comes and goes, but the last couple of weeks, it's been pretty bad.
Left side is painful side?
Yes.
So this is where you told me you have a pain, right? Right about right here.
Yes.
And then you've been telling me that you have had this pain since you have injured your left knee and you've been having problems here on and off. Is that correct?
That's correct, yeah.
Okay. I don't know if you know, you do have flatter foot than most people. You see how your arch is collapsing here like this? You get more pressures around this area. When you're supposed to have a normal arch here like this, your pressures coming to the foot from the ground dissipates a lot easier. But when you have a flat foot like this, it cannot really do that. So let me explain to you the significance of having a flatter foot and foot pain. So this is a foot model. So this is your ankle joint and this is your foot. Where you told me you have pain is right about here is where you said you have pain, right here in this. When you're walking, because of the fact that you do not have arch, back of the heel, as you can see, goes throughout this way, okay? And as you are walking this way, in order to be able to compensate so that you can have a flat contact to the ground, which is very important, the rest of the body, also the rest of the foot in the front, rotate through, which way? This way. So this is how you're walking essentially. Back of the heel has been rotated through this way. Front of the heel has been rotated through that way. So opposite way. This is the reason why you have pain in your big toe joint. And it also explains the bunion pain that you are having. It also explains the reason why you're having pain in this area. Okay? And this also explains to me why you've been having pain right here. Because this, which is not supposed to, but has more contact with the ground and takes more pressure than it should. So this is exactly what I mean. As you can see, there is completely collapsed arch, and then it's very apparently to be able to see the back of the heel has been twisted outward. Conversely, in order to be able to compensate for the back of the heels being rotated outward, her front of the foot has been rotated inward to be able to have a proper and normal walking patterns. Because of this, bunion had to develop because the big toe has to endure more pressures and stresses from walking. So this is your left foot. So just want to be able to orientate you, and I'll explain to you exactly what's going on with you. So this is the foot model over here. The one that you see over here is the back of the foot. This is ankle joint, as you can see right here. And this is the middle of your foot and then your front of the foot. So I just want to be able to let you know that I can see one of the reasons why you're having your foot pain. This bone is called talus, as you can see right here. It's supposed to be aligned nicely and even with this bone called navicular, but it's not. If you can look at it, it has been shifted upward here like this. Also, this bone called calcaneus has been also rocked upward, giving you this kind of motions here like this. Hence, because of the fact that those back of the foot has not been improperly positioned, this bone navicular has to drop down in order to compensate for the dysfunction of the back of the foot. So in order for us to be able to truly treat your foot, we also have to make this bone, this bone, this bone into proper place. And then, as we talked about, you told me that there's a lot of swellings in the back of the, the bottom of your foot, right? Yes. So this is this area that where you're having. From our examination, we have found that you have pain on your third and then fourth of your metatarsal head. So this is exactly where your pain is. Another thing we have to talk about is your big toe. So can you see a little bit of bump right here?
Mm-hmm, yep.
This is the bump that you see on your big toe. So because of the fact that there has been so much of dysfunction on this area, your big toe had to work overtime. What does it do when a joint works overtime? It starts to deposit more calcium, which means more bone. So that's exactly what this means. It means that. So this is where your pain is?
Ow, yes, ow.
Right here, right?
Oh, yes.
How about right on this side?
That hurts more.
So I want to also brush touch on your knee. So this is your left knee, and this is a bone called femur. This bone called tibia, and this is a small bone called patella. So those three are kind of making up the knee joint. So while you don't have any kind of evident broken bones on your knees, it tells me why you might be having your knee pain. Let me explain a little further. So in order for you to be able to function properly, your joint has to be properly aligned. It's just like having a properly aligned tire giving you the best mileage and the best function of your car. Same thing. If you're not having properly aligned joints, you're not gonna having a good function to your body, hence giving you a less and more optimal joint function. That's exactly what's happening with your knee also. This bone tibia is actually have rotated through a little bit more into inward, hence the reason why your kneecap has looking like it has been rotated outward. But in actuality, it's your femur bone has been moved inward. That actually gives you illusion of your kneecap being outward, but this is one of the reasons why you're having your knee problems. Yep, there's a problem right here. I'm getting a reading right about this area that tells me that there is nerve dysfunction around this area. Let me try to move your back and forth, try to see if I can find some tender spots. Pain right here. So just want to be able to orientate you for the X-ray right here. So this is your spine shot from the side, and this is your spine shot from the front. So this is the low back area we're looking at. And then the block right here, the block that looks like a white Lego block, is your backbones. And in between, I know that you are not able to see anything, but there is a jelly-like substance called disc that is situated in between. Notice how everything is pretty uniform here. The disc in this space is relatively similar as we start to get to this one. So, I don't know if you're able to tell, but everything is pretty well evenly spaced out until we get to this point. You see how there is a lot more fuzziness around it? Mm-hmm. This is what we like to call degeneration. So when you say that I have an arthritis to my low back, that's exactly the reason why. You're not yet 40 years old, but you still have a significant amount of degeneration. This is actually very old. I would say this actually is more than 10 to 15 years old. So I'm guesstimating that you have injured your low back during the time when you injured your knee. You just didn't really know about it, and then they start to become more and more evident with the degeneration. Thing about your low back is that your low back does not have any symptoms until it becomes really severe. So if you do not treat your low back, Number one, it will continue to be degenerative, which means that this space is going to be thinner and thinner to a point that there won't be any disc. And that at that point, you're going to start to have a lot more low back pain, or the low back pain will be much more evident. The problem with then is when you lose so much disc spaces, there is not really much we can do in terms of being able to help you non-surgically. Number two, this actually pertains more to what we talk about here. You see there is a little holes here like this, here and here.
Yep.
So through here, there are something that comes out from called nerve. Nerve is the one that makes you to move, feel, and also be able to function rest of your body, including your foot and ankle. So if there is a lot of degeneration in this area, the nerve that comes out from this area is affected. And this also perfectly explains the reason why you are having big toe pain. Because of the fact that you are having a nerve function being disturbed by degeneration over here, you've been having a little bit of interruptions to the nerve supplies to your big toes, hence giving you pains and other problems you've been having. This also is significant for your foot pain that we've been talking about. If this is not properly fixed or addressed, it's not going to be holding well or long enough, because this is going to be main supplies for your foot functions and foot nerve supplies. Without fixing this, any kind of foot problem that will be fixed will not be permanent. Without fixing this, all the foot functions that we have gained through the treatments will be more or less temporary. Try to touch your toes with your hand.
Sure.
I don't know if you know, you have been bending your knees so that you can get more ground, because you have a tight hamstrings and also your back of the thigh has been tight. Go ahead and try that one more time, please.
Sure.
Yeah, same thing.
Yeah, I can't.
So just want to be able to orientate you with the skeletal model here. So this is the head, your torso, your low back, your hips, your thighs, your knees, your legs, and your foot. As you can tell, you cannot really isolate the foot for foot problem itself only. Everything is connected. So, as you have seen before, and as you have seen and then demonstrated on you to yourself, if you do have a tight hamstring coming all across over here, it does affect with your plantar fasciitis pain. That's exactly what this is. So, in order for you to be able to have less pressures on your foot here like this, you need to be able to make sure that there is no problems on your knees and your low back. Also, the musculatures in the back of your thighs and back of your leg. Those are the continuous motions, and then the movements are provided by the muscles that are properly functioning and bones which is properly aligned. All right. I'm gonna pump the joint just a little bit. And here you go. Oh, wow. Okay, there we go. Okay?
Okay.
I'm gonna pump the joint right here first. Here we go. There we go. Take a deep breath in, breathe out. Let it go, let it go. There we go. Okay. There we go. One of the other things that I have to do to ensure that I treat your problem properly and also globally is that I have to address the tight muscles here and here. So when you start to have a tight calf muscles and the tight thigh muscles, you're always going to have more stresses on your foot. So I want to go ahead and stretch your foot like this, like I'm showing you here like this, on a daily basis. Is it painful?
Yes.
Okay, I'm going to just ease up just a little bit. You see, I haven't even gone up, this side I think is about 40 degrees, so you can tell how much of a tight musculature that we're dealing with over here. So, one thing that we have to ask you to do is that I want to go ahead and get a long towel and then wrap around your foot and then stretch your foot here like this and bring it as far as you can for about 20 seconds, 20 times in the morning and nighttime. Well, so tell me what's different.
It feels lighter. There's no pain. My feet feel much lighter.
Okay, turn around. And then tell me how much the pain has improved so far, from 0 to 100%.
Pain-wise, I would say 70%.
Okay, I know that we also stretch some of your muscles, so let's try to see if we can actually have you to touch your toes with your hand.
Better than before.
I see there's still a little bit of a bending at the knees, but it's something that we gotta work on.